tricuspid, and mitral. Now I'm going to listen with the bell for any added sound, extra sounds. Heart sounds are S1, S2. There is no S3, S4, murmurs, gallops, or rubs. I'm now going to now we're going to assess her neck veins. Her carotids are a 2+. With no bruit. I'm now going to assess your abdomen, so I'm just going to have you lay back on your back. The contour of the abdomen is flat. I'm just going to lift your shirt up a little bit. There's striae to the lower portion of the abdomen. I'm going to auscultate the bowel sounds and her aorta, iliac, renal, and femoral arteries for bruiting. The bowel sounds are normal active in all 4 quadrants, and all arteries have no bruit. I'm now going to percuss her abdomen. The abdomen is tympany in all 4 quadrants. I'm now going to palpate with some light palpation, so let me know if you have any tenderness with this. Any tenderness? And now I'm going to palpate a little deeper. There are no tenderness or masses with light or deep palpation. I'm now going to assess your aorta. The aorta is 2 centimeters with no lateral pulsations. I'm going to palpate for the liver. So I'm going to have you take a deep breath and out. Any tenderness there? The liver is palpable about 1 centimeter below the right costal margin, and it is smooth, and the margin of it is sharp. There is no tenderness. I'm going to percuss for your liver span. And the liver span is about 7 centimeters. I'm going to palpate for her spleen. So I'm going to have you take another deep breath. In and out. And the spleen is not palpable. At this time, I would do a breast examination. So I'm just going to state the normal findings. The breast, the skin is intact. It is warm. There is no dimpling. It is dry. The breasts are symmetrical. There is no tenderness or masses with palpation, and there is no nipple discharge. I'm going to assess your upper extremities. The arms are symmetrical. The musculature is normal for her body frame. There is no edema. Her radial pulses are 2+ bilaterally. And the capillary refill is less than 3 seconds on all 5 fingers bilaterally. I'm now going to assess for your muscle strength. So I'm just going to have you put your arms up like this, and I'm going to have you resist my force of bringing them towards me and pushing them towards you. And I'm going to have you squeeze my fingers. And I want you to fan your fingers out, and don't let me bring your fingers back together. Muscle strength on the upper extremities is a 5 out of 5 bilaterally. I'm now going to assess your lower extremities.
Wow.
I'm just going to pull your pants up here a little bit. They are symmetrical. The musculature is normal for her body frame. There is no edema. Her dorsalis pedis pulses are 2+ bilaterally. And her posterior tibial pulses are 2+ bilaterally. I'm going to assess your muscle strength, so I'm just going to have you resist my force of bringing your legs towards me and pushing them back towards you. And muscle strength is 5 out of 5. I'm now going to assess the sensory of the bottom of your feet to test for diabetic neuropathy. So I'm going to just put a little sensation on 4 different spots of your feet and let me know when you feel it.
Yeah. Yes. 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 Yes.
The sensory to the bottom of the feet is normal. I'm now going to assess your reflexes. I'm just going to do your brachial here. And then your tricep. Just relax your arm. And I'm going to do your brachial radialis. And do the patellar. And Achilles. And all of the reflex are 2+, and they are symmetrical in all the extremities. I'm now going to assess your gait, so I'm going to ask that you walk across the room. The gait is normal, the posture is erect, the striking of the foot is heel to toe, and the arms sway symmetrically. I'm now going to do 2 balance tests, so I'll have you walk the same way, heel to toe. Like this.
Oh.
Good. And then you can just stand right there, and I'm going to have you, I'm going to do the Romberg's test. So I'm going to have you stand here with your arms out like this and close your eyes. This test is done 30 to 60 seconds. Minimal swaying is normal. Any more than minimal would mean that her balance is off. And you can relax. The genital and the rectal exam are not done during this assessment, so I'm going to state the expected findings. The pubic hair is coarse and evenly distributed. The external genitalia is pink. There is no lesions, masses, or erosions noted. The cervix is pink and with no drainage or bleeding. The uterus is midline. It is not enlarged and it is not tender. There is a pap smear obtained during this assessment. The rectovaginal wall is intact. The rectal vault does not have any masses. The stool is brown, and the Hemoccult test is negative. And that is the end of my assessment.